Good morning. We'll call our meeting to order. The first item we have is request for bill introductions. Are there any bill introductions? Seeing none, we will move on to our confirmation hearing on Suchitra Padmanabhan. Does the committee have any questions? Is there anyone in the audience that would like to speak? Turn the mic on, please, and introduce yourself.
Hi, I'm Rebecca Floyd. I am the President and Executive Director of Kansas Development Finance Authority. I thank you for the opportunity to say a few words about Suchitra. She has been a fairly long-term member of the Kansas Development Finance Authority and our affiliate corporation, Kansas Housing Resources Corporation Board. She's been an excellent member to KDFA. She brings a unique skill set in, she has a background in bond analysis and pricing, which is, you might imagine, is very unusual and a fairly unique skill set. She's also serving as chair of Kansas Housing Resources Corporation. Both entities are extremely busy right now, KDFA with a lot of refinancing activity, and KHRC is integrally involved in administering a lot of the affordable housing program, along with affordable mortgage, tenant eviction, emergency prevention program measures as a consequence of the various COVID relief packages passed by Congress. It would be just an excellent opportunity to retain a board member who was very familiar with both organizations and our activities. So we would very much appreciate your affirmative recommendation of Ms. Padmanabhan.
Thank you.
Happy to answer any questions.
Okay, any questions for Rebecca? Senator Hawk?
Thank you, Mr. Chairman, and thank you for all the work. I know you had a lot of work in the past, and it just appears there's even more with what's gone on with the packages that we've had. And I'm certainly, Mr. Chairman, impressed with both her educational background and her work experience, reading over the questionnaire and the resume that she had. So I'll be strongly supporting her. Thank you, Mr. Chairman. Thank you, Rebecca.
Thank you, Rebecca. See no other questions. Thank you. Committee, we would, is there any other questions? Okay, Senator Clays.
Thank you, Mr. Chairman. I move the favorable, or the confirmation of Suchitra Padmanabhan for the Kansas Development Finance Authority favorably.
I have a motion, a second by Senator Hawk. Any other questions or discussion? All in favor? Aye. Opposed? Motion carries. Committee, next we will move on to Senate Bill 264, enacting the Kansas Fights Addiction Act to establish a grant program for the purpose of preventing, reducing, treating, and mitigating the effects of substance abuse and addiction. And I do have an amendment for that we had talked about. 264, the opioid one that we were going to amend to include K-Trax. Okay, do you have the amendments? Talked to, I think, Amy and maybe Jill, and I talked to them on several of them. Okay. All right, we can move on to a different one then. 2401. Okay. And 2020. Yeah, Senator McGinn.
Thank you, Mr. Chair, and I apologize. I did not get this drafted as I shared that I would, and we're trying to locate my computer right now. I'm hoping it's in my car. I just want to, I guess, discuss this with the committee and see how they feel about it. And, you know, I'm not going to fall on a sword for this, but I do think it's important to at least have the discussion. On page 3, starting at line 6, one of the members is appointed by the Association of Community Mental Health Centers after consultation with the Kansas Association of Addiction Professionals. I'm just wondering if that should be one member appointed by either the Community Mental Health Centers or the Behavioral Health, and I don't know if they're called board. I didn't get that specific language, and if anybody on this committee can help me out. There is a behavioral health board, and my reason for this is about opioid funding, and many times people who have mental health don't often have substance addiction issues, but people who have substance addiction abuses often have mental health issues. And so it almost looks like we're putting the community mental health centers in the driver's seat without hearing from the behavioral health folks. And then the other thing is, I mean, maybe it should say the Kansas Association of Addiction Professionals after consultation with the Mental Health Association. So I would like to hear other committee members' input on that.
Senator McGinn, I didn't catch you earlier, but I did visit with the Attorney General, and he was okay with the idea. I told him you'd like to have, an addition there, and so to keep the number odd, probably would need to add 2. And you suggested, the one you suggested was, in my notes.
Well, it's 11 right now, right?
I think it's,
So I wasn't thinking of adding another, but I'd be happy to, though. What I was thinking of was trying to put the substance abuse people, thank you, in the driver's seat rather than the community mental health centers on this. Senator Petty wants to maybe check.
okay, go ahead, Senator Penny.
I do notice that under the 2 members appointed by the Attorney General, one of them is appointed after consultation with addiction professionals.
No, I agree. That's the amendment I'm talking about.
No, but it's already in there. There's already one in there. It's on page 2,
First one.
line 37.
Okay, that's good. It's just that we're still in this consultation. So consultation to me means we'll go talk to them and we'll put Carolyn on there. I mean, my point is you can just put anybody. You can go talk to them and then put anybody on there. It just seems to me that we should somehow have either behavioral health or substance abuse designee in one of those categories. And maybe it could go back to,
We could make one of the Attorney Generals what you
that's
want.
what I'm thinking.
Yeah, and he was okay with that, because I told him you had concern on that. And so-
Okay. So it could read, at least one should be appointed by the addiction, Association of Addiction Professionals.
Senator Hawk.
Just a question. You mentioned Behavioral Health Board.
Yeah,
Could you describe that a little more?
that's why I need to.
It's not BSRB you're thinking about, is it?
There's one that is appointed at the state level, and do they have appointments by outside people, or is that totally in control of the governor's office?
I think groups nominate people, but the governor has final appointments for the board of BSRB, if that's what you're thinking. But I just wondered if there's another behavioral health board that you're thinking about. And
Well, it says, excuse me,
go ahead.
but in looking at this, the Kansas Association of Addiction Professionals, that tells me they have a group which would include, MIR, and I can't think of the other one that starts with a D, and
Well, just one, and I don't know that this probably doesn't clarify anything, probably muddies the water. I know when I was executive director of BSRB, legislation had put addiction counselors as a licensed category, moved it from KDADS under to BSRB, and yes, they do have an association. A lot of the people who work in the community mental health centers are probably addiction counselors too, but they're also psychologists and clinical social workers and marriage and family therapists. So there's a host of people who have licensure and training and certification to deal with addictions, not just the addiction counselor group or addiction professional group.
so if I may.
Yes, Senator McGinn.
I'm looking it up. Behavioral Science Regulatory Board has board members, a number of them, and it looks to me pretty well represented of the state. And then they have advisory committees as well. So I wouldn't have a problem using that organization under,
So would you want to add as one of his two, or an additional one?
no, one of his two comes from the Behavioral Science Regulatory Board. And then that does leave your mental health open still.
Yes, and it wouldn't mean they necessarily would have to be on BSRB board. They would just be appointed by BSRB board. And they might appropriately come from addiction counselor group. They might come from the clinical social worker group or the clinical professional counselor group, or I don't want to leave anybody out, psychologist or marriage and family therapist. All of them deal in the clinical licensure with addictions too.
So, Mr. Chair, would it say shall be appointed from the Behavioral Science Regulatory Board? From is not the right word. By? Yeah, appointed by. So the Attorney General, he would have the authority, but he would be picking from this board's recommendation. Yeah. Okay.
Is there any other comment on this from committee members? Is everyone satisfied with that? Senator Petty?
I'm satisfied with that, but it does still take me back, because Senator McGinn brought it up, to on page 3, the number 10 person, and I'm just wondering if it couldn't be one member appointed by the Association of County Mental Health Centers of Kansas without the consultation of the Kansas Association of Addiction Professionals.
Well,
Senator McGinn?
I'm not, yeah, I don't care. If this is in the Attorney General's category, then I don't care if you take the other out. But you're not changing because it's one of his two, so you still have 11.
Right, no, I'm not suggesting taking it out. I'm just suggesting just making a member appointed by the Association of County Mental Health Centers of Kansas and leaving out after consultation with the Kansas Association of Addiction Professionals.
Okay. As long as they're in another category.
They would still be number 10.
So your suggestion, Senator Petty, is to not change on line 37, but go to page 3, line 7, and leave out the after consultation with the Kansas Association of Addiction Professionals? Is that what you're?
Right, I support what Senator, the change that's been discussed and come up with through Senator McGinn, but it seems just cumbersome to still have after consultation with the Kansas Association of Addiction Professionals in number 10, just have it be an appointment from the Association of County Mental Health Centers.
Okay, so after we've changed the other, by behavioral science regulatory,
Correct, thank you.
and just leave that out.
I agree.
Everyone okay with that? Okay. And then the other amendment that he went after is to authorize KDADs to get $200,000 after the cities and counties have been taking their share. Pardon me? K-Trax, yes. Okay, so we'll wait on that amendment. We'll move on to something else unless there was something else someone had as far as, pardon me? Oh. Okay, motion was by Senator McGinn, second by Senator Clays to make the amendment for both amendments? Okay. Okay. So adding the language there on line 37, scratching the language on page 3, line 7, and then adding the 200,000 for K-Trax after the counties and cities have received their 25%. Everyone comfortable with that? Yeah. Okay. So we have a motion, a second by Senator Clays. All in favor? Aye. Opposed? Motion carries. So. Right. And he's going to bring an amendment. Hopefully, he'll have to get it. Have to get a hold of it. Is David on Zoom? Yeah, I was going to say maybe he could.
Sir, this is Jill. Would you please call on Scott, because Scott has is responsible from our office for Senate Bill 264.
Okay, thank you. Is Scott on, please?
Yes, Mr. Chairman, I just want to clarify. The committee's discussions so far have referenced the split between the state and the cities and counties. That was a part of the amendment that was included in the Attorney General's testimony, and to my knowledge, the committee has not adopted that amendment yet. So the bill as introduced does not have that set aside for municipalities.
Okay, so we have to accept that amendment also, correct?
Well, Mr. Chairman, if that is your intent, it was the testimony. It was in the testimony of the Attorney General to establish that municipalities fight addictions fund that had the 25% of the settlement monies and the remaining 75% going to the state. Like I said, this was included in the Attorney General's testimony. If you have that with you, it should be there. Otherwise, we can arrange to have copies sent up to you again. But it was that amendment that made that split. That amendment also did a couple of other things relevant to the discussion you just had on the members of the board. It was included in that amendment in the Attorney General's testimony in that member appointed by the Association of Community Mental Health Centers to strike that after consultation with the Kansas Association of Addiction Professionals language. That was also a part of that amendment.
Yes, I think committee, everyone should have that in their packet. It was the State Attorney General's cover sheet with the amendment. That's Sets up the municipalities fight addiction fund, and state treasurer shall credit 75% and then 25% to the municipalities fight addictions fund. Senator McGinn.
So what I'm trying to follow here is, will there be money, because you had talked to me about the amount of money, will there be, if we change this, money left to be able to continue to fund the K-Trax? This won't impact that.
This is a separate amendment, but then once we approve this one, then we'll have another one that comes in that says he should use the 200,000 of this after the cities and counties have their 25%, and that would go to K-Trax.
So the 25% is just clarifying language. It's not changing the proportion. That's what I was trying to figure out. If you give 25% to the municipalities, will there be money left for the K-Trax?
Right, that's what this does. This does 25% to the counties, and 75% stays into the fund, and that 75% will fund the 200,000 for K-Trax.
Okay, I just want to make sure we were doing that.
Right, we wanted to make sure we didn't goof up the agreement that was made with the cities and counties. Scott, should we withdraw our first amendment and go ahead and adopt this one first and then move on? To keep everything in order?
Or could we just?
Mr. Chairman, that might make sense just because the Attorney General's amendment, like I said, did touch on those appointments, partially to do the exact same thing for that appointment in paragraph 10 on page 3. And then it also makes that change to the Attorney General's appointees. So we would need some clarification from you how you
Okay.
want that to be kind of reconciled.
Okay, Senator McGinn.
So I make a motion to adopt the Attorney General's amendments along with the adjustments that we made with the committee.
I have a motion and by Senator McGinn, a second by Senator Clays. Scott, did you hear all that?
Yes, Mr. Chairman.
Okay. Senator Petty?
Did I hear it or just mishearing it? Withdrawing the first motion that no.
No, I added it.
Oh, I mean, it's already there, so. Okay, so.
I just adopted the Attorney General's amendments with the addition of our language on the committees.
Okay. I do have a question.
Senator Petty?
And I think it's not in this amendment, but it is to the 200,000 that Mr. Chairman, that you've spoken about. So I'm going to assume that when we see that it's going to be somewhere in that coming out of the state treasurer shall credit 75% of each such deposit to the Kansas Fights Addiction Fund. It's going to be coming out of that 75%.
Correct.
Thank you.
After the cities and counties get their 25, then it comes out of the 75. Any other questions? Senator Fagg?
Thank you, Mr. Chairman. The 200,000, where did they come up with that number at?
It was suggested by Senator McGinn.
Okay. Is there any reason? Just, yeah.
I believe the numbers are to pay for K-Trax is around $375,000 yeah, right. And it's coming out of, currently it's coming out of the pharmacists and the doctors' fees, and they're not very happy about that. And so but I also worked with Senator Hawk on this too, but the thinking was don't totally pay for it because, you know, they are the ones that write the scripts. They are the ones that fill the scripts. And this kind of helps them on their fee, but also they have skin in the game as well. They still have skin in the game.
Any other questions? Seeing none, all in favor? Aye. Opposed? Motion carries. So we'll have to wait for David and the amendment for the 200,000. So I think, can we just put this to the side and start on another one, Jill? Is that okay? While we're waiting on the amendment?
Yes, you could do that, sir. Oh, excuse me, Scott.
No, I was
Scott,
just
go
going to
ahead.
say, Mr. Chairman, David is on his way up with the amendment, so he should be there momentarily, but
Okay, we'll just wait
you're, of
then.
course,
That's,
free to move on.
I didn't know how long it would be, so we'll just wait for David.
Mr. Chairman, I would like to ask a clarification on when the two amendments are combined, just to make sure I'm following on that Attorney General appointee to the board. So the Attorney General's amendment that you just adopted, or part of what you just adopted, was to add that it was after consultation with the Kansas Association of Addiction Professionals. My understanding from Senator McGinn's amendment was that that was the part that was not being done. Instead, you were doing something with the Behavioral Sciences Regulatory Board, but I'm sorry, I couldn't completely follow. Is this member appointed by the BSRB, or is this still the Attorney General's appointee after consultation with the BSRB?
It was by the BRSB, right?
Yes.
Yes, that's what, you got it correct. Did David leave? Scott, did you get a copy of the amendment?
Yes, Mr. Chairman.
Okay, so as long as we're taking that 200,000 after the split, after the 75-25, because we want to make sure that we don't encumber the cash from the counties and cities.
Yes, Mr. Chairman. So at the front end, as the Attorney General recovers monies from opioid litigation, the split happens at the front end. So first 75% is put into the state. The Kansas Fights Addictions Fund, the 25% is put into the municipalities fight addiction fund. And then after that, from the Kansas, so the state share, the 200,000 would be transferred from that.
Okay, great, that's what we wanted, so. Senator Hawk.
So this new wording that's in section C that goes in between, on page 2, between line 27 and 28, I'm assuming then, from what you just said, Scott, if there's not sufficient money once that split is there, that this 200,000 would be prorated down? Is that a correct assumption?
Scott?
Mr. Chairman, Senator, no, if there are insufficient monies to make the transfer, no transfer would happen for that fiscal year.
So if there was only 125,000, since it wasn't 200, no money would be transferred?
As it's written currently, correct.
That's not exactly what I intended. Is there an easy way to insert a word that would get at that prorated amount?
Yes, so I think we could just change that last sentence in that subsection C insert, but I would need a little bit more clarity of, for instance, in your example, if there were only $125,000 in the state share, would you want the entire 125,000 to be, kind of up to the amount of the 200,000 transfer to happen first before any money is made available for grants applications?
Senator Hawk?
I thought I heard the chairman say he wanted to make sure that the cities and municipalities got their money first. So what I'm intending in this sausage-making process is to say they get their money first, but if the total amount of money there available is not enough to do the 200,000, from the report we got the other day, it sounded like, at least in this initial distribution of money, that's not a problem. In out years, it may be a problem. So I would just want them to get whatever might be, once the cities and counties got theirs, for them to get whatever might be available. And not be stuck that if there wasn't 200,000 left, that they might get whatever was left, 50,000, 100,000, 125. Do I hear 175? No. I think that's what we're trying to get at, and I'm perplexed about how to write that in there. But
Senator Petty?
Well, in the amendment that we already added on, as Scott, I think, alluded to earlier, it changed the act on page 1 and now says, and municipalities fight addiction fund. So the municipalities' money, if I understand it correctly, would not be touched at all, because this only is speaking to the Kansas Fights Addiction Fund. So the municipalities, because they're spoken to in the enactment at the beginning, now aren't impacted if this fund goes below 200,000. If you're trying to figure out a way to say that they still will get a portion, it's not going to impact municipalities at all. It's just going to, somehow you're going to change that word, no transfer shall be made under this subsection for this fiscal year. But, Mr. Chairman, is that correct?
Yes, I think you got it, hit the nail on the head. It's split right up front, and then after that, if there's not 200 available at some year, then there would be no transfer, and the legislators would have to address that at that time. Senator Hawk?
yeah, thank you, Mr. Chairman. If we said shall transfer up to 200,000, would that give us some flexibility in the AG's office, some flexibility in determining what might be available?
Scott? Did you hear Senator Hawk?
Yes, Mr. Chairman. I think that would help solve the problem. I think it would also raise the issue of who then makes that determination. If there is exactly $200,000 in the state share for any given fiscal year, for example, would you then want that entire 200,000 to be transferred to K-Trax? Or is there some, kind of other determination you would like to be made to determine if there is enough money available?
Maybe it's one of them deals that we should just leave it at the 200,000. At some point in time, when this fund gets down to where there's issues, I'm sure there's other grants that are going to be in there, and they probably will come before the Ways and Means and say, yeah, then we'd have to change it at that time. Would everyone be comfortable with that, just leaving the 200, and then when the money is gone, they'll have to come before the legislature and try to ask for funds, because I'm sure there's going to be other grants. Hopefully, I know that there was some in here the other day. So, Senator Hawk.
Yeah, Mr. Chairman, I'm comfortable with that, and I think just the fact that we've had this conversation and we know what our intent is, I think that kind of sets that we do want this money appropriately to go to K-Trax. And my own personal thinking is that that's certainly a big part of what the state needs to do to fight the opioid crisis. So, and we, as Senator McGinn said, we've constantly had a problem since I've been on Ways and Means of finding out an appropriate way to actually fund K-Trax, and fortunately they've gotten the grant. So if that's the understanding and intent that we have, I'm perfectly willing to leave the wording there and work it out next time it becomes a problem, and I'm reasonably sure it will be a problem in the future.
Any other?
I just want to make a quick comment.
Senator McGinn.
So new people realize these dollars in the beginning came from federal grants, and then, but they did not have, the K-Trax folks did not have a long-term plan after those grants ran out. So that's why we've been dealing with this for some time. Thank you.
Senator Fagg.
Thank you, Mr. Chairman. Could somebody give me an example if it was 225,000, how that would break out?
Well, if it was 225, 200 would go to K-Trax and 25 would go to other grants.
That would be split then?
If there's other grants in there that the Attorney General, I mean, I think it was what, the Boys Club that was here last week. And so like if they're getting a grant for whatever, they would get it out of anything over and above. Starting out with, I think he said the initial fund was like 3.7, 3.8 million. And then going on maybe 200, 250,000, you know, unknown, but ballpark guess. Senator Fagg, okay. Any other questions or comments? Okay, so if everyone's comfortable with this amendment, we would look for a motion in a second. Senator Clays.
Mr. Chairman, I move the amendment.
I have a motion second by Senator Hawk. Any questions? Seeing none, all in favor? Aye. Opposed? Motion carries. Are there any other changes or amendments from? Seeing none, Senator Clays.
Thank you, Mr. Chairman. I move the committee recommend Senate Bill 264 favorably as amended.
I have a motion. Do we have a second? Second by Senator McGinn. Any questions? Senator Petty?
I hope this doesn't in any way muddy the waters here, but I did notice in the materials that we had that we did have information from the Kansas Department of Health and Environment that they would need funds from the Kansas Fight Addiction Fund to support a position that would help coordinate the program and support the coalition. Just wondering if have we covered that in any way?
Well, I think that the board will be able to, you make decisions as far as where funding will go. The 11-person board will make those type of decisions.
They're going to have to
Senator
do
McGinn.
data collection, the data analysis, and the statewide community level coordination.
It's in the fiscal.
Senator McGinn.
Thank you. It's in the fiscal note.
Yeah.
Yeah. I assume this was part of the bill, so, I mean, generally, we don't take a fiscal note and amend it into the bill. I mean, it clearly says they need $64,000 or 67. 67.
Scott, are we looking at this correctly?
I'm sorry, Mr. Chairman, could you repeat the question?
Yes, there's a fiscal note, and we were assuming that the 69,114 is included in the bill. We didn't need to do anything extra with that, did we?
I mean, we don't generally write in fiscal notes into a bill when we have a fiscal note.
So looking at the fiscal note, it appears that they indicate that expenditure would come from the Kansas Fights Addiction Fund, so it would come from the proceeds of those opioid settlements.
Okay, so it's included.
So that's up to the Attorney General, though. I mean, is that correct? Would that be up to the Attorney General?
Would that be the
Yes.
Attorney General, Scott, that determines that, or is this the 11-person board?
Mr. Chairman, I'm sorry, I'm not entirely sure. When I read the fiscal note, it looks like it's coming from KDHE. That is saying they would require the FTE. I can't really speak with the degree of expertise on what went into the fiscal note.
But it is funded, correct?
That's what the fiscal note indicates.
Okay. Any other questions? I have a motion and a second. All in favor? Aye. Opposed? Motion carries. Senator Clays. Well, your motion was to kick it out favorably. Okay. Okay. So, all right. Next, we'll move to, sorry about that. Shirley just said that any fiscal notes are also addressed at omnibus, so it'll be looked at again. Senator McGinn.
That is correct. All bills get reconciled at the very end when we do the budget. All bills cost money for the most part, and they get reconciled at the end in the budget.
Okay, next one we will work on is House Bill 2021 authorizing the issuance of bonds for the construction of a state veterans home. And if you grab your files, 2021, I have a couple of amendments that we talked about. We had talked about a couple amendments. One of the amendments was to make this for northeast Kansas versus just 4 or 5 counties up in northeast Kansas. So it would entail all the northeast. And then that there would be oversight by the State Finance Council before they proceeded. I think, yeah, I got them. Yep. Yep, that's fine. Okay, and we're going to do these other two. For that. Prisons. Well, this is prisons. Yeah, this is the education. Prisons. This one. Okay, committee, on this amendment, it adds the oversight by the State Finance Council for final approval. And then in place of just the 5 counties, it says northeast Kansas, including but not limited to these counties. And then it looks like on line 28, prior to the issuance of any bonds pursuant to this section. And then on line 34, and the State Finance Council acting on this matter, which is hereby characterized as a matter of legislative delegation and subject to the guidelines prescribed in KSA 75371 CC, and amendments thereto, except that such approval may be given when the legislature is in session. That's a motion and a second by Senator Clays. Any questions on the amendment? Senator Fagg.
Thank you, Mr. Chairman. I just want to understand why Northeast Kansas. Is that where we feel like the need's there? Why is it focused in Northeast Kansas?
Well, I believe that, pardon me? Yeah, the testimony of those that were here, that's where they were pushing. They said how many veterans were located in the northeast part of the state.
Process. I just want to make sure.
Right, that was more veterans in that area that have a need for this.
Thank you.
Senator Hawk.
Yes, and I'm on that Veterans Affairs VCAP Advisory Board, and we have the other 2 veterans homes in western Kansas. So as the testimony indicated, we've got that area covered, but we really don't have the Northeast Kansas area covered.
Any other questions on the amendment? Seeing none, all in favor? Oh, sorry, Senator Erickson.
That's okay. Just a very, thank you, Mr. Chair. Quick question. Do we have Northeast Kansas definitively outlined, or is there just kind of a general common sense acknowledgement that that is or is not Northeast Kansas?
There's no definition in here on that. And it would be like someone mentioned when we had our committee hearing the other day, Riley County, which is that northeast, I guess. If the committee decides that's northeast and we approve that, that's where it would be. Well, that's why I said it's yeah. Any other questions? Seeing none, all in favor? Aye. Opposed? Motion carries. Senator Clays.
Is that the only?
Pardon me? Yeah, I think that was
Thank
it.
you, Mr. Chairman. I move the committee recommend House Bill 2021 favorably as amended.
We have a motion, a second by Senator Hawk. Any questions? Seeing none, all in favor? Aye. Opposed? Motion carries. Committee, next we will move on to House Bill 2094. I don't think so. Just a second, I'll grab my file. I don't believe we discussed any amendments on this bill when we had the hearing. Did anyone have any amendments? Seeing none, Senator Clays.
Thank you, Mr. Chairman. I move the committee recommend House Bill 2094 favorably for passage.
Motion and a second by Senator Erickson. Discussion on House Bill 2094. Seeing none, all in favor? Aye. Opposed? Motion carries. Next, we will move to House Bill 2401, authorizing the Secretary of Corrections to enter agreements for public-private partnership for projects for new and renovated buildings at correctional institutions for educational skill buildings and spiritual needs programs, establish a nonprofit corporation to receive gifts, donations, grants, and other monies, and engaged in fundraising projects for funding such projects for educational, skill building, and spiritual needs programs. Committee, we did talk about an amendment on this one. Senator Solentrup had requested an amendment for page 3, line, between line 14 and 15, that the Secretary shall submit to the House of Representatives Committee on Corrections and Juvenile Justice and the Senate Committee on Judiciary at the beginning of the regular session of the Legislature in 2022, and annually thereafter report of the following: status of any public-private project entered into, funds raised for the education, skills building and spiritual needs programs and services, building, renovation, or construction of such programs or services, names of all education and skill building program and service providers, brief description of the programs and services offered, number of, excuse me, inmates enrolled in the education or skill building program or service, and graduation or completion outcomes of each educational and skilled building program or service. So basically, he's asking for a report as to how these programs are progressing and working. So we'll pass these out. That's a motion. We have a second by Senator Clays. I'll wait for a few minutes. Everyone can look this amendment over, and then we'll go from there. Has everyone had an opportunity to read that? Everyone satisfied with the language? Any questions? Seeing none, all in favor? Aye. Opposed? Motion carries. Are there any other amendments? Senator Clays, sorry. Any other amendments? Seeing none, Senator Clays?
Thank you, Mr. Chairman. I move the committee recommend House Bill number 2401 as amended favorably for passage.
A motion, we have a second. Senator Kirshen seconds. Any discussion? Seeing none, all in favor? Aye. Opposed? Motion carries. Committee, that finishes our work for today, and seems like I think we got pretty much everything out. Senator Clays. Oh, sorry, yes.
I had a question.
Okay, okay. First, before we adjourn, okay. First off, need to make sure everyone gets their confirmation packages back to Nancy so she can take care of them. And then after first adjournment, we are going to have a meeting before omnibus. And it would be on April 26th, which is a Monday. And we're going to meet at 9 o'clock. Hopefully we can get everything done in one day. If not, we will also plan on working the 27th, which is Tuesday. So just so you can put them on your calendars, I wanted to announce that that's the plan right now, is for meeting April 26th, Monday, and possibly the 27th if we don't complete our work on Monday. Any questions on that? Okay. With that, is there any other business? Seeing none, thank you all. We are adjourned.